I'd like to speak for a few minutes about the court case against and the judgment against Dr. Robert Young, who was fined or penalized $105 million by a judge for his relationship with a cancer patient. Many things we could say, but $105 million is some kind of political statement. The field of modern medicine has been after people who disagree with it for decades. And they've been violent in one way or another against many doctors. In this case, Dr. Young, I can't testify that he's a perfect clinician, that everything he does is right or his motives are perfect. Can't say that about doctors either. But to destroy a man for trying to help somebody the best he can, to destroy a man legally who is more right than the doctors in the medical system, which don't understand anything about what he understands. They don't understand anything about pH and what the significance is of pH in cancer. That when people get more acidic, which is what he talks about, when I talk about acidity, I talk about low oxygen conditions, low oxygen delivery to the cells, and all the problems that causes. Dr. Young probably, according to his theories, emphasizes diet probably too much. But part of the case against him was that he was using baking soda, sodium bicarbonate, intravenously to treat cancer. That work comes from a famous doctor in Rome. Unfortunately, with that particular treatment, IVs of bicarbonate, seems like only this doctor in Rome had success with that. I am still the only doctor in the world who's written a book about sodium bicarbonate. And the medical world doesn't understand that at all, because bicarbonate turns to carbon dioxide. And carbon dioxide is a vital nutrient, food, essential for physiological functioning. Without CO2, we don't get oxygen. So in my work, I use sodium bicarbonate orally and transdermally in baths. You can continuously use bicarbonate orally many times a day, and saturate the body and bring the urinary pH up to 8, where it's very limited what you can put in the blood, bicarbonate. I use a 5% solution. Yes, it's perfect for emergency situations, sepsis. ICU departments use it all the time when people are dying. But for cancer, there are other ways of doing that. So whether Young made the mistake of trying to use that in a way that's very difficult, IVs, it doesn't justify destroying his life for applying treatments that are civilized, reasonably safe, where we can't say that about chemotherapy, we can't say that about radiation therapy. This patient that sued him was suing him because he convinced them to not go with chemotherapy and radiation. That's pretty thin. I feel sad for what the system has done to this doctor.